I'm producer Dave, and we're joined as usual by our co-host Amanda Carlin.
Hello, producer Dave.
Hello. How are you today?
Very good, thank you. I hope you are too.
I am, yes. I am keeping well. Today's the Thursday, the 23rd of April 2020, and this is episode 12.
Yes.
In our new schedule. So if you haven't heard, we've now moved from Mondays, Wednesdays and Fridays to Mondays and Thursdays, just because we couldn't cope with producing that amount. So this is the new shifted version. So how are you? How have you been since the?
Oh, yes, been very well, thank you. Yes, I've been a bit. I was a bit shocked to hear the chief scientific officer's thoughts on lockdown, and the length of time it's likely to carry on for, because it's something that I thought in my mind but didn't think it would possibly come to reality. It was a bit of a shock hearing somebody official say it.
Yeah, to be realistic, we kind of know that it's going to be around. It's not just going to disappear. This is not just like some of these winter bugs that come and go, and they die off in the warm weather, and it's like the D&V that sort of spreads up every year, and it comes, it goes, and that's it, gone for the year, and then out it comes next year.
Yeah.
This is going to be hanging around for a very, very long time. And the only way that you're going to get through this is either immunity, if that's possible, or a vaccine.
Yes.
And they don't even know if there is immunity from COVID-19 at the moment, because they don't know, which is why they're trying to get people to come forward now for testing for antibodies.
Yeah.
Just to see what from people who've had the coronavirus, and what has been left in their body afterwards, so they can then do the DNA tests and check the blood work and see if there's anything there, and whether that has any research can be done from that to help produce. One is the statistics from it, and the other one is to obviously try and help produce the vaccines. But even if they do that, I mean, we're still, some kind of, even if only 100,000 positive cases, although there's a lot more testing, but just because you've tested doesn't necessarily mean that you've not had it or will get it. It just means at that particular point you don't have it. So we've got over 100,000 confirmed cases. Now, out of 70 million people, that's a very small number. So it's a case of stopping the other 69.5 million people from getting it at some point. So that's going to be a big challenge for the medical profession, because that was something that we talked about before. How do you go about giving a vaccine program? Can you produce that amount of vaccinations and medicine to treat the whole of the population in a short period of time?
That was after you'd watched the film Contagion, wasn't it?
Yeah, I mean, but it's an interesting thought, and it's not something. I think that's part of the roadmap that they're not talking about at the moment, on how to exit the exit strategy, which they're still working on. I think they've got ideas of what to do. They just don't want to bring it into operation or say too much about it at the moment, because they don't want to give people false hopes about the ending. Because as we've seen in the numbers, the numbers are going up and down. It's flatter.
They are.
It's flatter than it was.
Yes. I just think that there's a fear that people could become overwhelmed by it all, and that's not good for anybody's mental health. So I did think at first, right, we're not being told everything, and I found that frustrating. But now I think, well, perhaps we're being told as much as we can cope with right now. And I don't mean that disrespectfully. I feel myself that, processing the information that's coming in, I've got just enough information coming in now.
Yeah, I mean, you're going to get all the voices on the internet going, oh, well, we're not being told everything, so they're keeping stuff from us. And like you say, sometimes you don't need to worry about the next stages because it's kind of irrelevant at the moment. We're trying to deal with the stuff at the moment, so we have all the protocols for how we're dealing with isolation and how we're controlling what we have at the moment. The exit strategy is something that we don't need to be thinking about for another few weeks because it's kind of irrelevant. We don't want to be jumping, and we don't want people to be doing things that are ahead of everyone else. We don't want people panicking, and also people trying to bring in their own sort of exit strategy for saying, oh, well, someone's doing this, therefore we're doing that. It's a case of we all kind of need to be doing the same thing at the same time. So that's why they're trying to sort of stagger the release of information, because they want everyone to do, right, it's quite simple. You do this, this, and this. And then when we get past that bit, then we go, right, now we have phase 3 and we do this, this, and this, so that everyone is doing the least amount of things together all at the same time. And that's not difficult. The problem is that you've got people going, oh, but I want to know what the plan is ahead. Well, it really doesn't matter because we're not there. So as long as they say, yes, we have something in plan, and we will tell you as and when it's needed, then that's kind of all we really need to know. We don't need. It's not that they're deliberately. Well, they are deliberately holding it, but they're deliberately holding it for a reason, and that's to try and stop mass panic and people doing things that they shouldn't be doing.
Yeah, absolutely. I think also the numbers of people that have lost their lives, sadly, to this virus, it's awful. The numbers are large, but they're just numbers in our minds. It's just a number. It doesn't sound huge, and when you put it in proportion to the amount of positive cases, there's that going on as well. But we've got to remember that every single life has an impact on somebody. If they're gone, if that person goes, it has an impact. And losing somebody, a loved one, is a huge thing, isn't it?
It is, and it's not just affecting one person. It's one person's death affects a lot of people.
Yeah.
The families, the businesses, co-workers, friends. It has an impact. One person has a big impact on their social circle, and that's the thing. It's been, it's dotted all over the place. From the very top of Scotland to the very bottom to Cornwall and Kent, and everywhere in between. And it's it's so randomly spread out. That's the thing. It's not just clusters here. It's just everywhere. Well, it's Thursday anyway, so we have clap for carers at 8:00 tonight.
Yes, that's going to be good.
So hopefully everybody.
We'll see if there's more people.
Well, I hope so. Yeah, there's some interesting letters being put on about in the local press whether it's necessary to have clap for carers, and some people don't see the point. And I think it's who are we actually clapping for? And it's not. It's just bringing people together and just thanking people, because there are people, key workers in the community, and you don't need to know who they are or where they work or where they live, but the fact is that they are working hard, and they do appreciate. My daughter, she says that she is out and about at that time. She's still working, and she's hearing it, and she gets embarrassed by it.
Oh, bless her, does she?
Because she feels that she's just doing her job. But
Oh.
it is the fact, but she does recognise that people are doing something about it, and they are acknowledging the fact that work is being done. So it does mean a lot to the people that are the key workers that do hear it, and they do appreciate, because there's no real other way of showing support.
Yeah.
And because there are so many key workers in each community, they are hearing it and they are appreciating it. So I think it's a lot more than just, why are we doing it? Why are we clapping? There's a lot more to it, and it's keeping the NHS going.
Yes, there is nothing wrong with showing gratitude, and it doesn't matter how you show gratitude, and there's nothing wrong with growing emotionally with your neighbours, and it's a social meetup, physically distanced. Things do. It's probably the only time I'm speaking to my neighbours at the moment.
Yeah, I think there's a lot of people the first time they've actually spoken to the neighbours. And that can't be a bad thing.
No, not at all.
So I think it will change communities as a whole, certainly for the next few years at least. I mean, it may go back to how it was before, but I think we've got an opportunity to capitalise on it and make the most of these small communities and the direct communities with other people and your neighbours.
Yes. Yeah.
Okay, so we'll look at news. The big debate for today is face masks. That's being looked at by the SAGE group, who are reviewing or going to issue the policy for today. The general medical consensus is that even if you get people to wear face masks, they don't know how to use them properly. And the whole point of the face mask is not to stop you getting it. It's trying to minimize you giving it to other people.
Yeah.
And that's what they're trying to get. It's not a protection from other people. It's not going to stop you going out and about and getting it from outside. But what it can do is it can minimize when you are coughing and sneezing. It's minimizing, but people aren't handling the face mask properly. They're not disposing of it properly. They're not wearing it properly. So there's lots of issues about it can potentially do more harm than good. Some people have said you can use, well, what the suggestion is maybe wear a scarf, but then you've got to wash the scarf. So whatever you're using, any material stuff, you've got to wash to protect yourself. Now I've heard now from the NHS what they do is when they're they're washing at a minimum of 40 degrees in soapy water and that will kill the bacteria, and that's how they are cleaning their scrubs and the materials. So that's, if you can wash your whatever you're wearing in your face mask, then that would be the way to do it. But yes, it's a big issue, because if they say, right, you've got to wear face masks, as we've seen, there is only so many face masks being produced in the UK. Now, you have, say, off the top of my head, say there's 2 million NHS workers, and there are another 68 million people in the UK who are then told they need to wear face masks. Where are they going to come from?
Yeah.
Who's going to produce all these face masks? And you're supposed to have them, they're supposed to be disposable, and you're only supposed to wear them for so long and then you get rid of them. You've got an ecological disaster on your hands, as I've found in some places where face masks are turning up on beaches because people aren't going to dispose of them properly. If you're also not handling, because they're classed as bio waste, because they've got diseases on them. I mean, I saw one on the street and I was like, I'm not going to touch that. I'm not going to, I should put it in the bin, but I haven't got the procedure, the PPE to handle that. That is a biohazard on the floor. I'm not going to touch it because I don't have the right kind of equipment. And that's the problem, that these things can cause more problems in themselves. So it's not just the answer of I'm going to have it. And one of the doctors been interviewed this morning was saying that he's seeing people wearing them as they're walking around town, which is ineffective anyway, and then they were stopping to talk to someone and they were taking the mask off to talk, and I was like, well, you kind of got the whole thing wrong. If you're talking, that's when you wear your mask. So people just can't even wear them properly. So there's a lot of issues. It's not just as simple as it's a face mask and you have to wear it.
Yeah. That's interesting.
It did make me laugh, but yes. So we should hear later on today what the government position on face masks. Have
you seen about Japan? Japan haven't got social distancing rules in place, and what they're doing is telling citizens to wear face masks, and so COVID-19 is a problem for them.
It is. To start with, they didn't have an issue, and I think that's where we were talking about the different strains and how that's affected different communities. I think they were one of the first types of strains, so it affected them differently. Now I think they're having a knock-on effect as it's mutated or as different strains come in, and the way. Because I think the idea was that the first strains were quite hardy and that they weren't being passed as quickly, which is why I think China has got such low infection rates, partly because of the lockdown, but partly because it was slower to transmit because it was in the early stages. So I think now it's becoming more, it's evolved, and so therefore its transmission is a lot higher. Or it's easier to transmit from people to people more readily. So yes, I think there is this second wave is starting to affect, and I know sort of the Asian countries are beginning to start to suffer from this, and they're starting to see their cases rise.
Yeah, it is, isn't it?
So we'll keep an eye on them, because it will be interesting to see where how they deal with it, and it's going to be a case of watching it as this thing goes round the globe a couple of times.
I think so. It's interesting to see how different countries are tackling the whole situation. They all seem to be so very different.
Yeah, and that's the thing is you've got a couple of countries that have not being affected in the same way, so everyone's saying, oh well, we should be doing the same as them. They're doing that way, they're doing this protocol, and they've got these results. And like we were saying before, you kind of comparing apples and pears. Like Germany has a different level of mortality rates because it affected a different group of people, and it really depends on. You kind of have to match like for like before you can compare the results. So you can't just compare yourself with another country and say, well, they've done this, so therefore we should be doing the same. These countries are now having different longer term effects, and they're having to change their policy as well. So you can't just automatically jump on and say, we should be doing the same as them. You kind of just need to go by your country and how best to try and respond to how it's evolving and changing.
And meanwhile, the US.
Oh yes, and even the chief medical advisor went against what the president said.
Yeah.
He said, it's all fine, and he went, no, it isn't. He completely contradicted what the president said, and so I'm guessing 24 hours and he'll be out of office.
Yes.
He will lose his job, and it's just, which is scary.
It is really, isn't it?
Banks. And as of yesterday, the Lloyds Bank in Wisbech is closed for a deep clean.
Yeah.
So it's not closed. It's just they've had to shut down to make sure everything's all decontaminated, and will open up again, and they will announce when that will happen. I went to find the Lloyds mobile bank yesterday in Chatteris, and that has stopped.
Has it?
So Chatteris now has, for definite, has no banking capability whatsoever.
Blimey.
And obviously if that's the mobile one out of the way, then there's loads of other small towns and villages around. But there's nothing on the website. I went on the website on Tuesday to say where and when it was due, and went there yesterday, and there was another lady, an old lady there, waiting for it, and nothing turned up.
Oh, that's terrible.
So there's no communication. It was only because I went on the discussion page and said, anybody know what's going on? And someone said, yeah, it's not coming. Well, that's not how you're supposed to run.
No, it isn't.
No information has been passed, because some people, certainly the elderly are reliant on access, because there's next to no buses. They've got no other means of leaving so how do they pay stuff in? How do they get stuff from their post office accounts, or whatever the financial account, or the building societies and things? If you can't get that through the post office, where else are you supposed to get it from?
Oh, it's terrible. I do feel for residents in Chatteris. It's not fair.
Yeah, it's rough times at the moment. So yeah, that's the update for the banking. Obviously, if we hear any other banking news, then we'll let you know. More finance. The Fenland District Council have been voted worst in handling or distributing the coronavirus business grants. Only 42% of the funds allocated have been handed out. Peterborough City Council came next last with 44%.
Did they?
Yeah, and it's but this is all within Cambridgeshire.
Right.
But I think part of it is just not businesses being able to get in touch with FTC or vice versa. So I don't think it's a case of they're not handing them out. I think it's just a massive breakdown in communication between trying to contact the businesses and the FTC.
I think that's very true. From what I understand, Fenland District Council have been very quick to process applications, and Peterborough, interestingly, were processing before Fenland.
Yeah.
So I'm surprised, but equally, as far as I'm aware, from businesses that I've spoken to, they're all very happy.
Yeah, and that's the thing. It's stats and recordings is one thing, but the reality is not always the same.
Yeah.
So I think if you are a business and you know that you do fall into the categories where you are below a certain size and you are a rateable business, or you're in the entertainment business, then there are different grants. So, but you've got a way of actually getting in touch. So if you think that you should be eligible, if you go onto the FTC website, you will find there's paperwork, which we mentioned before. There are forms there, or there are contact details for you to get in touch, and even just to inquire, because they only.
Or if you're not sure, just look and see.
Because that's the thing is, if they don't hand out all the money, what they're going to do with the money? Could that then go to support the small individual businesses that aren't eligible?
I don't know. That would be something, wouldn't it?
Yeah.
That would be good.
If all the individual self-employed businesses all got in touch, and then they go, right, okay, we've got, I don't know, 5 million left in the pot which hasn't been claimed, and we've got 20 businesses that have all applied that aren't rateable, then we split it up between them. That would be nice, but that's never going to happen. But yeah, it's a nice thought.
Yeah, but these are amounts, they're sums of money that could mean the difference between make or break for some businesses, so it is worth looking at it.
Well, that's it. £10,000 does go a long way, especially if they're not having to pay rates for the next 6 months.
Yeah.
It's not going to pay all the staff, but at least it helps pay all the bills that are currently going through that businesses are. Because I say I'm in the same situation. I'm having to pay things like the website fees have suddenly turned up. For the annual payment of support for the website, that's turned up, and there are other annual fees that seem to come out this sort of time. So all the admin I've got at the moment is all having to pay for services that the business uses.
Yeah.
The stuff that I use on a regular basis, on a monthly basis, that have to be paid. That money's still got to come from somewhere. I'm not as fortunate as others. I don't have that sort of same support from the government, so I've got to find the money from elsewhere. So yeah, it's the businesses still have a lot of internet businesses don't have the same kind of compassion. These are automated billing processes.
Yeah.
They haven't been turned off. You just automatically get sent saying, this is what you owe, pay it now.
Yeah.
Because a lot of the companies, they've all gone into either sort of not furlough, but they've either reduced their hours so you don't have the people to support these online businesses. So they're just ticking away in the background doing their own thing. So there's no compassionate element of it. It's just here's your bill, pay.
Well, I do think it's funny, or ironic even. I think it's ironic that EE's call centre has closed down and you can only contact EE's customer service by internet at the moment. I think it's hilarious because we had an issue. We're with EE and the internet went down, so we couldn't contact them.
Yeah. It is madness, and that's not the only case, I'm sure. I mean,
they're a telecoms company.
Yeah. It's it's madness.
It is, isn't it?
If you can't work, but that's the thing. It's the nature of the beast. You can't, if your staff aren't there to support it. It's just the ironic nature of the fact that it is a communications business that can't actually be communicated with because there's no one to man the phones. Yes, there is irony in there. The bottom line is, if you feel that you are eligible or you're not sure, get in touch with the FTC and talk to them and find out, and they will tell you.
Yes.
So, but because they are processing the applications and doing it quickly when they are.
Yes, they are.
One thing mentioned was we talked about Zoom media. So we're talking about media and stuff. We were talking about Zoom applications for people doing online conferencing and video chats. The boss has apologized for all the security issues that have arisen.
Oh, that's interesting. I noticed Parliament were using Zoom, weren't they?
They do use it for some aspects of it. They've said that they'll use it for the non-secure stuff, or the sort of the lower level issues, but the top sensitive stuff is being used by something else. So there's no reason for not using it. It's just you've got to be very careful how you use it and make sure that you're not passing out codes, access codes and passwords to other people online, or letting them have access to it, because they are hacking into it. And one college professor said that he was then inundated with obscene videos from people because
really?
which was obviously upsetting and disturbing to him and the other people who were on that call.
Because that must have been horrible.
Because you've got no control.
No.
So he's apologised. It's basically because it's a small company, and it just gone boom. It's just gone global, and everyone's trying to use it. So that brings about technical problems of small flaws that are in a small product suddenly become a massive issue on a big scale when hundreds of millions of people are using it. So they hadn't anticipated that it would ever be that big, So they are.
Oh dear.
They are promising fixes for that.
That's good. That's good, and it's good that they recognise it and they're doing something about it.
Yes, it is. So we'll keep an eye on that as well, and give any updates as and when we have anything. Do you have some news? Something about Captain Tom, maybe?
Oh yes, Captain Tom has tweeted today. Lovely Captain Tom, and he says he's thankful for people's offer of help. For various items, people are just offering him things like walkers and what have you, and he says he's got everything that he needs, and thanks people for their kindness, but he asks if people would instead donate to the fundraiser rather than looking at giving him items that he doesn't need.
That makes sense. I think what they're looking at, well, the last time I heard yesterday was something like 27 million. I don't know what it stands at today, but I know it's become the main access point for raising money for the NHS, and I think everyone else has now realised that instead of giving to lots of other sort of small campaigns, they feel that one, it's a worthy cause, and two, it's just an opportunity, or it's a way for them to actually give money to the NHS to help them.
Yeah, certainly because it's such a big campaign, the money's going to be directed to the right place.
Yeah.
So that's a good thing. Because there are worries, aren't there, about where money goes to and how it's administered. So this is such a big thing. It's not going to be administered inappropriately.
It would be interesting just to do a follow-up and just see how the money is spent, just to see where it goes and who it's actually helping. I mean, are they...
I think it would too.
It would just be nice to know where it is going. So we'll see. Right, I believe you have some news on schools and school meals in the area.
Yes, I do. Thank you, David. So Cambridgeshire County Council are pleased to announce that Aldi are joining the list of supermarkets accepting free school meal vouchers, and that's from Monday, 27th of April. And parents and carers are asked to please contact school for more details. And families whose financial circumstances may have changed, please do get in contact because they might be eligible for the scheme as well.
Okay. That's it, because people's circumstances change as the lockdown has had impacts on different families. So
yeah,
it's always worth just to keep an eye on it and just double check, because you may be eligible for it now.
Yes.
Okay, that's good. Anything else? Animal rescue?
Oh, yes. DEFRA have changed their policy, and they've now removed restrictions. So rescued animals are now able to be rehomed. And I know the RSPCA have put up their list of available animals. Mm-hmm. But you need to check with each individual rescue centre for their policies on home checks and what have you.
Okay, that makes sense. I suppose because there's always that handover period, isn't it, where they would come out and check the place is suitable environment for animals to be rehomed with. So, yeah, obviously that's had an impact.
Yes. And also, and I'm sure the rescue centres would say this, animals do need homing, obviously, but it's very important, I think, if you are rescuing an animal, adopting or fostering an animal, that you consider during lockdown the animals are going to be used to you being at home, and then after lockdown that they may have some abandonment issues, so be aware that could happen.
Yes, I can imagine that with well, any kind of animal that's going to have contact on a daily basis, cats and dogs certainly, and then suddenly there's nobody in the house again. That's going to be quite traumatic for them.
Yeah.
There's going to be lots of surprises.
Yes.
A lot of protests as well. So yeah, be prepared for that.
Yeah.
Or at least try and sort of stagger your going back to work. So maybe once the lockdown's lifted, they will sort of increment how people go back to work. So yeah, it's obviously affecting the family, but also will affect your pets as well.
Yes.
So yeah, so look after them as well. They are an integral part of your family. So yeah.
Yes.
But the main question is, what would Doris do? How is Doris?
Doris is fine, thank you. Yes. She's mending well.
Good.
And she has a lot to say.
Oh, good.
So today, Doris says, Happy St. George's Day. Happy St. George's Day, David.
Yes, it is. Thank you very much. Happy St. George's Day to you too.
Thank you. Doris has asked if children and young people could look up the history of St. George. Mm-hmm. He is a legend.
He is, yes.
She'd like young people and children to find out, where did St. George come from? And how was he made a saint? And which King of England made St. George our patron saint? And Doris suggests children and young people make some drawings. That's a surprise, isn't it?
Doris likes her drawings, doesn't she?
She does, doesn't she?
She's a drawing-aholic.
Yes, she is, isn't she? Yeah, she'd like to see drawings of St. George slaying the dragon, put them up in windows for people to count on their household strolls during daily exercise, and then they could be passed on to sheltered housing for older residents to enjoy.
Well, that's just reminded me that I did some work with the March Mummery group.
Oh, yes.
Before Christmas, and part of their show was the slaying of St. George slaying the dragon. So maybe I'll put a link to, if you want to entertain the kids and watch, because it's the children version.
Oh,
not the late night pub version. So it is suitable for children as well. So what I could do is I could put a link to that from here after the show as well. So that would be good for them. Something that one person, I think it was Kathy, someone sent me a link talking about the Fenland Flag. We're talking about nationalist, or local nationalism and identities, and it was something that was mentioned that Fenland does have a flag of its own. Now that was news to me. I wasn't aware of that, but it has its own unique style, and it has the Fenland tiger is the animal that's on the represented on the flag. Now, if you bear with me a second, I will find out the name of the lady that passed on the information.
I tell you who uses the Fenland flag quite often. There are two organisations that we talk about. The Echo Company, Andrew Callaghan.
Yeah.
He's a user of the Fenland flag, and Fact used the Fenland flag as well. And as you're entering Chatteris from Doddington...
That was it, Cheryl White.
Oh,
right,
right.
Sorry, Cheryl Wright, my mistake. She was the one that got in touch and asked if we would just raise the awareness and bring help raise the popularity of the flag.
Yeah, it's brilliant.
Because it's looks like a yellow. It's got blue on either side, two block colours on either side, and a yellow block in the middle with a red fen tiger in the middle, in the raised position. I think there's a difference. There's indication of if it's in that position as opposed to being on all fours. That indicates something else, and that I know that there is significant meanings, and I can't remember what it is, because that's the difference between like St George's, the Wales flag and the Scotland flag, because they're in different postures.
Oh yes, yeah.
So yeah, that's the Fen flag. Fly that.
No, that's Doris's contribution for today.
Cool. Okay, we'll go to the daily stats. We have total number of cases worldwide of 2,662,000. So we're now over 2.5 million. Number of cases, positive cases in the UK is 133,495, and the number of deaths so far is 18,100 deaths in the UK, which is just horrific, and we're certainly catching up with France, which is I think it's 21,000. So yeah, it's not good, whichever way you look at it.
Yeah, 18,100 too many.
Yeah, I think trying to get people to understand the sort of the scale of it, something that we talked about just before the show, like how do you understand, you can understand half a dozen people dying, it's something that you can comprehend, but when you start getting into tens of thousands, it becomes it's almost like an arbitrary number. It's so big you can't physically grasp. Now I think what would be an idea would be to compare it to stadium sizes, and that's not something I've seen yet, but if they said, right, well, a small stadium that houses 18,000 football players, or capacity of 18,000, and say, well, it's this one or this one, I don't know if that would make it easier for people to comprehend, because they can physically see how big a stadium is. I don't know what the answer is.
I think it would help.
I know that analogy has been used for other things before in the past. It's just whether that would be something useful now.
I think it would give some perspective. Yeah. It just reminds me of the First World War. I remember, learning about it in history, and the first major battle and the numbers that were killed. It was shocking. And I remember walking out of the school classroom thinking, oh my goodness, all those young people, were slaughtered. And it took such a long time to process that. And then, as we spoke about other battles, it just became numbers.
Yeah. I think also being a child as well, the comprehension of what is bigger than, most don't even know what's more than 10,000, because they've got nothing to compare it to.
Exactly. So Stadia.
Yeah.
It's a good analogy.
Yeah. I'll see if there's anything out there, but it's certainly not something I've come across so far. I'm not saying that no one has done it, because it is something that does crop up every so often when trying to sort of scale things. Yeah, well, I'll have a look and see if there's any other references. Okay, local chat. Life of lockdown. something I wanted to go back and talk about was ecology. That was something that we talked about before, and funny enough, I think it was last Monday we talked about it, and we talked about how the ecology of our local environment will change as a result of the lack of human activity. Now, we've already seen photos of pollution levels in cities having dropped significantly. There was a video posted from Venice 2 days ago, and it was of a giant jellyfish swimming through the Venice canals. But because the water was so clear, amazing. You could actually see it because the pollution level has dropped. You can actually now see the crystal waters of the Venetian lagoons. Yeah.
Wow.
So that's had a massive impact on the local environment. And so someone actually had a camera. They managed to go down the canals and actually show the underwater life, the marine life in these canals, and it looks absolutely fantastic. But that's something that we're seeing impact on their environment. But this is slightly different. It was a couple of years ago the councils mentioned about not feeding ducks and geese and swans bread because they said that was the wrong kind of diet. They can't process too well that kind of meal, so they were saying use bird feed and things. But then 6 months ago or so they then retracted that because people were then not giving the ducks and geese and swans any food at all. There was like a counter a knock-on effect of removing the bread issues. So they then retracted it and said, please give them something, because there were a lot of malnourished ducks, because obviously they're big. They were so used to being hand-fed from passers-by and tourists. Now, obviously, no one has actually mentioned this yet, but this is something that sort of came to mind this morning. If no one is out and about, if people aren't going on walks as families down to the riversides, or you're only getting a handful, who's actually feeding the ducks?
Oh, good question.
So are they suffering? Are they're going to suffer because they're not getting anything? Or certainly their access to food is going to have massively decreased. So if you're taking your daily stroll, take some bread and go and feed the ducks.
What a lovely thing to do. Yeah.
Part of
the little ducklings. Yeah. Oh, David, the little ducklings are out.
Of course, yes.
It'd be lovely.
Which is another excuse to go for your daily exercise and go for a walk down by the river. One store that's reopened, we'll talk about reopening, but it's an experiment. And we talk about coming out of lockdown and how they're going to handle this. B&Q have said that they're now being given permission to open, but they're going to do it as an experiment because it's obviously not the standard food or essentials in that respect, but obviously there is a need for it. So what they're going to do is they're going to open 61 stores across the UK, but they're going to limit the number of people in the store. Yeah. The same way that the supermarkets are doing. They're going to have social distancing. They're going to have, I think they've got the floors all marked out. You can only have so many people in the store. You can only have so many in certain areas as well. And then so they're going to see how that works. And then obviously that then may have an effect on other hardware stores and other supermarkets of that kind of ilk. So so they'll see how that goes, and obviously that may have a wider impact on businesses in the future.
That's interesting.
But if it doesn't work, then obviously they'll have to shut it again.
No harm in trying.
Yeah.
There is a problem.
Yes.
Though, in that B&Q stores tend to be in out of town shopping centres, don't they? So people will be having to drive to get to them.
Well, yes, because even if they buy stuff, the stuff that they buy is going to be heavy anyway, so they're going to need transport to collect whatever it is they're getting.
It doesn't feel very much in the spirit of lockdown. That's the only thing I'll say on that. That's my opinion.
I think so, but I think that's why they're doing this as an experiment, just to see where it works and where it doesn't work. What are the impacts of opening something like this?
I wonder how many B&Q stores there are actually nationally. So not all of them, I guess, are going to be in the out-of-town areas. So maybe it's not so bad. Like the one in Wisbech is next to Morrison's, isn't it? So I suppose you could go to Morrison's for your essentials and then pop across the road to B&Q. That's not so bad, I don't think.
Yeah, I think if you're looking at proximity, then you're driving out for your food shop, and then you can then take in a couple of the other other stores at the same time. So you're not necessarily making a drive to lots of independent individual stores.
Yes. Yeah, I think it's really important that we as a nation keep to the spirit of lockdown.
We have to.
We do, don't we?
We have to keep it going.
Because it's the only way we're going to get the other side of this.
Yeah. And like I said before, we have to all do the same thing at the same time. Otherwise, it's not going to work. If people start ignoring it and going off and sunbathing, going for walks and have mass meetings, this isn't going to stop.
Yeah.
And that's where people will keep dying, and you're going to keep getting the fluctuations. And we're still going to lose lots of people unnecessarily. Yes,
absolutely. We've all got a responsibility, not just to ourselves, but to our neighbours as well.
I mean, you see the number of people the families that have been affected, and they're going on and they're in tears, and they're just saying, look, just follow the rules. Just do what you've been asked to do, because they've had to deal with it firsthand. And they've seen how traumatic and how devastating it is to the families, and also what the patients go through. So you can only be told so many times. Okay, well, look at space.
Oh yes, space. That's so exciting. Yes.
There's a lot been happening with space, and what's quite interesting, a lot of people on Facebook certainly friends that I know, are all talking about it as well. This week, because of the clear skies, the Starlink satellites have been visible, and at a reasonable time as well, between sort of 9 and 11 o'clock, because it shifts every night. So they're being illuminated by the sun. It's dark, and you've got a nice clear scene of these satellites going over. And I actually got to see them for the first time a couple of days ago as well. I've been actually looking for the last week, going out whenever it says that they're passing. And there are various apps that you can download that you can go to, and they'll show you where they are. But because of positions or whatever, I was unable to see them, or they were in darkness or whatever. But 2 nights ago, I went out looking for something else, and I saw the first one going over, and then I saw another one, and I went, oh look, there they are. But yesterday, SpaceX launched the next batch, the 7th batch of satellites, the next 60 satellites to join the constellation. And that went up at 8:30 yesterday. And when I looked at the map, and you could see that the track was going to be, so it took off from Cape Canaveral, and as it reached orbit, it then went over the UK. It actually went over our house, over Fenland. So it had actually separated about 10 minutes before it got to the UK. So I ran outside, and lo and behold, it went over, and you could actually see them, a very small trail, but just a cluster of 60 satellites all together, and it was really bright. It was probably just as bright as Venus, which we can see in the west at the moment.
Yeah.
And I saw that go hurtling over. So either tonight or tomorrow night. I think it's tomorrow night. It's the next visible. But if you have a look, you will actually see them spread out a bit further apart. So all the others that are going over, there's like one, and then there's another one, there's another one. Here you're going to see about 60 all within a small section of sky as they start to separate and go to their allotted locations.
It's really exciting, isn't it?
It is good, and it's exciting to know that all these things are happening, and it gives you something to do as well, something to look forward to. And I know SpaceX have had a lot of criticism because the fact that they are so reflective. They are going through trials to actually make them less reflective. But it's kind of, I know you can kind of see they've done it because it's advertising, because everyone's going, oh look, they've done something and everybody knows who's done it. But so if you make them invisible,
and who's behind it,
and then but if you make them invisible, then nobody will see them. So then you kind of like, there's no it's like advertising. It's a weird form of advertising for the business.
I find it similar to Richard Branson's marketing formula that he used to do. He was always doing stuff, wasn't he, and got the brand out there.
Do it in such a way that everybody notices. Because you've got to admit that everyone is talking about it.
Oh, they are.
That's the thing, is everyone's been talking about the Starlink. I mean, a lot of weird. It is unusual to see that many large clusters, and people have gone, "Oh, it's aliens, it's UFOs, it's little green men coming from Mars who are." And it's like, it's funny. The first thing that people think is it's a UFO, it's an alien. Therefore, it's someone coming to see us from across the galaxies to put in lots of satellites. It's interesting to see all this happening, and what's also happened is the Lyrids has also had their peak in meteorites as well. So there's lots of things going on in the sky at the moment, which has just reminded me there was actually a video in Holland, in Netherlands actually, of a meteorite landing during the day, and there's a video of it hitting the ground.
Wow.
Now I don't know how true that is, whether it's a genuine video or not, because I must admit I looked a bit suspect at first, but it might be genuine. But I can imagine there'll be loads of meteorite hunters with their metal detectors going off to trying to find it, because you can see it actually hit the ground.
Blimey.
So, but because it was a daytime one, then it's slightly different, because you normally see them at night, but because you can physically see it going in. So I'm going to go and investigate that one, see if that's actually.
So when lockdown's over, you might be taking a trip to the Netherlands. Then.
Yeah, might do. Yeah. Go and find all the rare metals.
Yeah.
Or it could be something else. Yeah. Have you been looking to the skies as well?
Yes, I loved it. Yeah, it's very exciting. And I'm really in awe of the photographers that have captured some of it.
Yeah.
It's, there's some good photos on social media, aren't there?
There are. There's been quite a few people who've decided to have a go at nighttime photography.
But it's something that shouldn't be missed. If you can have a look at it, it's worth looking at, isn't it?
It is, yeah. I mean, I don't think we've got any sightings. It's in the wrong position today, so I think tomorrow's the next visible. The 24th is the next visible scheduled time that you can actually see it go over. If you haven't already been told, the car insurance companies have said that they're going to reimburse most of their customers by £25 because the number of claims have dropped. So I've been sent an email from my insurer to say that I'll be reimbursed £25. So most people should get something. So worth just checking your emails.
That's good. I didn't know about that.
So it's not a lot, but everything helps.
every little helps, so Tesco says.
Yeah. I was interested to hear about oil prices yesterday.
Oh, I know.
That they're actually gone into negative figures for the first time.
I know.
So they're actually having to sell it to the suppliers to take it, so they would take it off their hands.
Yeah, absolutely amazing. But actually, that is something, David. That's good news for oil heating consumers. But as we're in lockdown, I do think it's worth remembering that utility bills the other side, or very shortly, are going to possibly be much higher than expected because people have spent time at home.
Yeah.
So I would say, and I'm sure Doris would say this too, that the money you're saving on fuel for your motor vehicle, perhaps it's worth putting that away for your
electricity bills.
Yeah.
I mean, we've already noticed that our we've now got one of these smart meters, and I don't know if it's just seasonal, but we've definitely used more than we would normally use.
Yeah.
And I think that's exactly the point, is that we've got more people at home using stuff round the clock, and it's also been chillier as well, so the heating's been on more.
That's true. It has, hasn't it?
Yeah. So just a combination of things. So yes, I can imagine that. I mean, it will all balance itself out throughout the year, but that's just something to bear in mind. That if everyone is at home, so everyone is using lots of electrical devices and television all the time, which does all add up. So unless you turn off the heating and just read a book, and just use candles, and not drink tea, it's drink water, cold water. So some good news to finish off. Have you got anything else to add to?
I have got one thing, actually. There's a little 6-year-old boy called Wilbur, and he's attempting to walk 10 miles in 10 days to raise funds for the NHS. And Wilbur, his full name is Wilberforce Turpin. That's a wonderful name, isn't it?
It is, yeah.
His grandparents live in Mainey, and they're a couple called Ursula and Keith Berry. Wilbur has a rare chromosome abnormality, so it has a major impact on his mobility, and he has a frame to keep him upright.
Mm-hmm.
So this is a huge undertaking for him.
Yeah, I can imagine.
And he wants to do like Captain Tom and do his bit for the NHS. So there's a fundraising page. It's a Just Giving page that can be found on the Mainey Facebook pages, but also Fenland Citizen and Cambridgeshire Times. But interestingly, Keith Berry, Wilbur's granddad, he worked with Captain Tom.
Oh, wow.
When Captain Tom was managing director of March Concrete Products many years ago in the 1980s. Keith worked for that company for 21 years.
Yes, that was something that got raised a few days ago, that Captain Tom actually lived in this area, in the Fenland area.
Yes.
So that's our...
So we love him even more now, don't we?
We do, yes.
Yeah. Under rural news, yes, there are. Yes, there's some rural news. So we have got parishioners in Doddington, Mainey and Benwick. They're helping local hospitals by making scrubs and masks, and the initiative is being coordinated by the First Doddington Cubs, and Appleby is a point of contact. And the group have put a shout out for fabric made of cotton or polycotton, so any old sheets or duvets that you've got lying about in the airing cupboard, we've all got those, haven't we?
Yeah.
In a lockdown clear out, perhaps they could be passed on. And also they require buttons about the size of a penny. They also require drivers to collect and deliver items safely, and people to cut fabric. They want sewers and people who can knit and crochet, because apparently they're also making knitted and crocheted parks for people on wards to have, which is quite nice.
Okay.
And the George Inn in Doddington have released classes for a virtual dog show where photographs of animals have been asked to be submitted. It's a bit of fun.
Yeah.
And you can find all the details on the George in Doddington's Facebook page.
Brilliant.
I think that's everything. Oh, there is one more thing.
Okay.
And there's more.
And there's more.
There's more.
I've got one more as well. Go.
Have you?
Yeah.
It's the 75th anniversary of VE Day on May the 8th, and I know we've already covered this.
Yeah.
But villages and certain streets in villages, they seem to have got coordination going on, and they've got all sorts of plans. So what we would like to know is, what are your plans in your village to celebrate the 75th anniversary of VE Day on May the 8th? Remembering we are likely to still be in lockdown and physical distancing rules will still apply. So we'd like to hear what you're thinking about doing, please.
Okay. The last bit, which I've just realised, is a local charity. It's called the Care Network for Cambridgeshire. They got in touch as a result of seeing our coverage in the press.
Oh, lovely.
So that's good to see. They are a support group for vulnerable and isolated people. They look after people who are over the age of 18, and they offer a telephone support line for people, which is open 7 days a week, 24 hours. And they're obviously focusing on things like mental health and mental well-being. Now, she's happy. I've spoken to the lady in question, and she's happy for if anybody has any general questions that they want to submit regarding mental health and how to cope in these times. And what we'll do is if anyone's got any questions, we'll collate them, and then we'll try and do an interview with the lady in a week or so.
Oh, that's a good idea.
And she can then talk a bit more about how the operations, how the group is operating. But if you wanted to talk to them anyway, I don't have the phone number for them, but if you do look online for the Care Network for Cambridgeshire, you'll find details there. And there is someone there at the end of the line to help support at this time. We'll try and get her online, and she can maybe explain a bit more about what they do and how they operate.
Yes.
So yeah, just bear that in mind, that there are groups out there to help support people going through tough times at the moment, and don't feel that you are completely isolated and that you're on your own. There are people who will listen and will help and talk to you and offer advice.
Yeah.
And if you are listening and you do have an issue and you don't know who to approach, drop us a line and we'll try and find some organisation. If you are desperate and you are looking for someone to help, we can maybe try and find an organisation that will help support, point you in the right direction.
If we don't know the organisation ourselves, we'll know who to ask to find the information to signpost.
Yeah, definitely. There are lots of groups out there who do coordinate, but it's just knowing who to coordinate with. So yeah, if you have any questions, let us know, and we'll pass them on to the Care Network. Obviously, if it's personal, then you can get in touch with them directly.
Yes.
Right, I think that's it from me. We've had a lot to cover today.
We have, haven't we?
And I thought it was going to be a short show. I thought, I've only got a couple of things. It'll take us 10 minutes.
Oh dear.
So that's it for us today. We will be back on Monday with the next show. thank you for listening. People are still listening and watching, so thank you very much for being with us on this small journey, and hope that we are entertaining and educating and all those good things. So it's goodbye from me.
And goodbye from me.
And we'll see you next week. Bye-bye.
Bye.